Hydara from the Gambia. I work at the Edward Francis Small Teaching Hospital. I was recommended to the Merck Foundation by our able Chief Matron through the Office of the First Lady of the Republic of the Gambia. Oncology care in my country, it's really lacking in terms of human resource, in terms of material. Currently, we don't have any oncology doctor who is a specialist in oncology, and we don't also have a oncology nurse who is also a specialist in nurse oncology. So, which is really a problem when it comes to oncology care in my country. And in the rural areas, patients, we have a lot of patients from the rural areas, but at the end of the day, all those patients are cared for by oncology doctors, general oncology doctors, not specifically oncology, specialized oncology doctors per se. So all these things are challenges of oncology in my country right now. In improving cancer care in my country, we need capacity building, which is the key thing, because even if structures are built and materials are available, if we don't have the human resources, if we don't have specialists in those areas, it's going to be very difficult for us to go through all the cancer patients that we are having right now. We need our doctors and our nurses and other lab technicians, because we cannot work without them. We need specialists in all those areas so as to give good care to our patients, the cancer patients, especially the gynec cancer cases that I am currently studying here. And also the other thing is we need structures. Right now in the Gambia, we don't have any hospital that is specialized in cancer care. All the patients are coming, even from the rural areas, they come to the general hospitals where they are cared for by the general specialists. When it comes to material-wise too, we need materials that can help us in caring for these patients. Like in preventive oncology, we need materials like the colposcopy that is going to help us in screening for these patients. We need materials when it comes to radiology. Radiotherapy currently it's lacking in my country. We don't have any specialists on radiotherapy. We send patients outside for radiotherapy, which is really challenging for my country really. This Merck Foundation Oncology program, it's really going to help me in caring more for my patients when it comes to oncology care in my institution, because like I said, we have patients that are coming, gynec oncology patients that are coming. We do care for them, but this training, it's going to help me in knowing exactly what I am caring for and how I am going to care for these patients, because screening, it's also an issue. So my training here has exposed me to screenings and also caring for them in the wards, post-surgery and after surgery and before surgery. So all those knowledge learned here are going to help me in care for these patients, and is going to help me greatly in being the midwife or the oncology nurse that I really want to be. And for my institution, for my country at large, this program is really going to help us in developing something for the cancer care patients, because we can set up something that is going to help them to have better care than before. My expectations before joining the program were to come and gain knowledge in gynec oncology, because I am a midwife, and in my department, in my country, I can say we don't have any nurse oncologist. So I am expected to come here and learn new skills that are not available in my country to be able to care for these patients. So my expectations were from preventive to palliative. We need to have that knowledge that is going to help me care for patients from the time of their precancerous stage until they are diagnosed, until palliative care, and which I guess it's met, because I've been exposed to so many areas, all those areas when it comes to this institution here in Tata. In Tata here, I've been exposed to a lot of things, like I said, from preventive to palliative. I was exposed to the preventive department, in which I have learned a lot, where they do all the VIAs, the pap smears. It was a great experience. So I've also been to the wards, the medical wards, the surgical wards, where they see pre-operative patients and post-operative patients. I've also been exposed to the daycare where chemotherapies are done. I am exposed to how chemotherapies are given to patients, medications are given to patients every day, and also to the radiotherapy theater. I was also there, and I was exposed to how radiotherapy is done to these patients, and also the operation theater. At the operation theater, I was able to see how gynaecology oncology patients are taken care of, how the operations are done. And also at the palliative care ward, how patients are counseled and families are counseled on palliative when it comes to cancer care. So when I return to my country, this program is really going to help me and my country at large, especially my institution, to be able to screen patients that are coming, even though we're doing it, but it's just going to, it's a plus, an added advantage to my institution and to me. To the new aspirants of this training program, I'm advising them to take it up seriously, because leaving your country and coming all the way to another country, it's big challenging, but you're here to learn and you're here to get new opportunity. You're given opportunity by the Merck Foundation, and you're here to have new skills, and this is going to help you in a long way. So take it up seriously as expected. I would like to thank the Merck Foundation for giving me this opportunity and for giving people in my country this opportunity to come to India and learn new things to go and develop our country. And also a big thank to the Tata Institute for accepting me in their institute, and also to all the departments that I've moved to. They have been really grateful and they have been really working with me. I'm very, very grateful to all of them. And also to my country, a very big thank you to the Office of the First Lady and also the Ministry of Health for giving us this opportunity to come and explore for the benefit of the country. And also to my chief matron and also my departmental matron, who has been very helpful since I came.